Okay, what I want to tell you a little bit is about applications of SWIPS technology, SWIPS dual pulse technology in periodontics and endodontics. You know, when we think of lasers, we typically think of incision, excision, cutting, ablation, coagulation, but particularly in the dentistry, lasers are also used for irrigation or debridement, and of oral cavities such as root canals, endodontics, or pockets, peri-implant pockets, or periodontal pockets. So Photona introduced SWIPS. It stands for shockwave enhanced emission of photoacoustic streaming, to deal with some of challenges of irrigation of such small narrow cavities. So in endodontic infection, there are three treatment steps of endodontic treatment. First is shaping. Second is typically debridement and disinfection. Debridement and disinfection, the goal is to remove the smear layer and debris and to open the root canal for irrigant flow. So that's the goal of the irrigation. The laser endodontics has evolved. It started really as a direct laser radiation, in fact, even for shaping, so ablating of the root canal. Then it followed with photoactivated disinfection to introduce certain absorbing liquid into the root canal that was absorbed specifically by a special laser wavelength. This was for disinfection. And then the final stage is laser-activated irrigation. And in this laser-activated irrigation, laser is delivered through fiber, typically through fiber, to a fluid-filled root canal. Laser is absorbed in root canal. A bubble develops, and this bubble grows, and then at a certain point reaches the maximum size. Then it starts collapsing. And this growth and collapse, this dynamics results in rapid fluid movement and in the irrigation effects. The best laser for this type of treatment is erbium laser because of the high absorption in water, in OH. So very small, small energy, pulse energy is required, typically 10 millijoules. So there's no heating, but very effective bubble formation. There are two types of laser-assisted irrigation. One is just classical laser-assisted irrigation, where the fiber tip is positioned deep into the apex, up to the apex, and acoustic waves are then formed exactly at that point. The risk of this treatment, of this type of irrigation, is that there can be extrusion, which is not desired. The latest SWIPS, what we call SWIPS, laser-assisted irrigation, in this case, fiber tip is placed in the coronal part, and acoustic waves and shock waves are spread from that fiber tip. Similar challenge in periodontal pockets or peri-implant pockets where we want to remove biofilms, bacterial biofilms. What we found out is that although there is violent movement of the liquid during this bubble dynamics, even more important is to establish conditions where shock waves are generated as a following bubble collapse. And in large reservoirs filled with fluid, this happens regularly. So we get, we have short enough pulses, high enough absorption with, let's say, erbium laser, you get a shock wave formation. However, in very small reservoirs like root canal or a periodontal pocket, the bubble growth and collapse is being slowed down because of the friction of the walls. And as you can see here, the oscillation time, so how quickly the bubble develops and collapses, gets prolonged significantly as the root canal, let's say, diameter gets smaller. So the challenge was how to create shock waves in spite of this limitation that all these oral cavities that we are treating are very small. And the idea was to introduce dual pulse, an additional pulse following the first pulse. And the role of this pulse is that as the bubble develops, and there are some secondary bubbles also usually formed, we just when the first bubble starts collapsing, we emit another laser pulse. And this bubble, the second bubble that starts developing, exerts pressure on the collapsing bubble and speeds up the collapse, and we get shockwave formation, not just at the location of the bubble, but also all the secondary bubbles also collapse and generate shock waves. This is important because this is how we get effects deep within the cavity, right? Deep in the root canal or deep in the periodontal pocket. So this is just an example. You can see that when there is a dual pulsing, you get much more activity deeper in the root canal. So as I said, it's the timing when the second pulse should be emitted is very important. If you miss the timing, if you do not emit the laser pulse exactly when or close to when the bubble starts collapsing, you will not get this effect. So this is a challenge, and Photona solves this challenge in two ways. One is that we carried out extensive research of the different root canal geometries, sizes, and so on, and developed algorithms to predict what will be the cavity oscillation time, what will be the right timing. And now these algorithms are part of the system. The doctor just selects the tooth type, medium, small, large, and the device itself determines what is the right timing for any fiber tip, energy, or other conditions. But we found out there is another way, which we found some benefits also in periodontal treatments, and this is auto sweeps. With this modality, the delay between pulses is repeatedly swept. The delay grows and then decreases and grows and again. So the final outcome is that the resonant condition is established at least once during that such cycle. But typically there is there's an area, there is a certain range of times where this resonant condition is established. And there are some other benefits because of this fast sweeping and changing conditions. There's additional turbulence that is occurring in the fluid as well. So what we found out is that this shockwave generation supported by sweeps results in improved effectiveness of biofilm removal using chemical disinfectants. The challenge with periodontal pockets, it's larger. It's a bit larger because in endodontic canals, the walls are hard, dentinal walls. In periodontal pocket, one side is soft. And soft walls, as we found out, is they dampen the oscillation of bubbles even more. So this is an example of very soft. Also, if you look at soft tissue, if it's infected, if its periodontal pocket is affected, this tissue is even softer than normal. So the softest tissue means the most infected tissue, less hard, what we call hard tissue, but still soft. It's not infected. And as you can see here, with soft tissue, in infected tissue, we don't get the bubbles. We don't get this shockwave generation. And with the medium infected or hard, we do get, especially with hard. So the challenge is, well, but we want to treat the soft tissue, right, the infected tissue. So how do we get this shockwave generation also deep into the periodontal pocket? And again, we use auto sweeps. This is an example without auto sweeps, single pulse, and this is with auto sweeps. and you get shock wave generation also in the bottom of the periodontal pocket. There is a lot of research. Some has been published, some is still going on. We are studying also the disinfection efficacy of not just cleaning, but also disinfection efficacy of this method. And the results are very promising. As you can see, the effect of cleaning of the biofilm and disinfection is much stronger with auto sweeps. So yeah, using sweeps photoacoustic activation helps to remove biofilm even at large distances from the fiber tip. So this is really important in endodontic canals, but also in periodontal pockets. And that's my conclusion, actually. So thank you very much.